I'm Karen Utley. I'm president and co-founder of the International Foundation for CDKL5 Research. And this evening, I am talking with Dr. Helen Leonard and Dr. Downs from Telethon Kids in Australia, where the International CDKL5 Disorder Database is housed. I want to begin by saying how excited I am to make this celebratory video for the 10-year anniversary of the International CDKL5 Disorder Database. When I think back to the early days and how our partnership in this work started, I feel a sense of pride in how far we've come. I realize that much of our success has been driven by the efforts that you both have made to build a relationship with our community, and I hope we're able to highlight those efforts in this conversation. Helen, I remember the first science meeting that IFCR ever held in New Orleans. You were there. Jenny, you were also there, along with some others we'll talk about. And we were offered an incredible opportunity to start a registry at virtually no cost in the beginning. And that was valuable for our young organization. So Helen, can you share a little bit about this time?
So parallel with the Australian Rett syndrome database, we established in 2002 an international Rett syndrome database, InterRett, in order to recruit large numbers of cases so that we could look at genotype, phenotype relations, or the relation between the characteristics of the child and the specific genetic mutation. A number of families who had children with what we called then the early onset seizure form of Rett syndrome had enrolled in our database. When this was children who actually had a mutation in the CDKL5 gene. In 2012, we undertook an analysis with our PhD student, Stephanie Fair, to compare the characteristics of these children with CDKL5 with those with MECP2 mutations. We did, and when we compared the questionnaire data from InterRett on the two groups, we found major differences between the characteristics of the children with CDKL5 and those with Rett syndrome. Those with CDKL5 were extremely likely to have seizures within the first year of life. They had severe global developmental delay and severely impaired gross motor function. They were also very likely to have sleep disturbances, abnormal muscle tone, hypotonia, teeth grinding, and gastrointestinal issues. Most were unlikely to be able to walk independently. We also found that individuals with CDKL5 did not meet the official definition for what is called the early onset seizure form of Rett syndrome. And it became clear that CDKL5 was a different condition from Rett syndrome, and that the questionnaire we had developed for Rett syndrome was not appropriate for CDKL5. This made us realize that we needed a completely different database specifically for CDKL5. And we needed data which would tell us about the age of diagnosis, how easy or difficult it was to reach the correct diagnosis, about the clinical features, their variation, and about the natural history of the disorder, which appeared, in fact, a disorder which in fact appeared much rarer than Rett syndrome. We'd already made contact with several families who were on the board of the International Foundation for CDKL5 Research, including Karen. And so we discussed this project with them at the conference in New Orleans. And we also discussed whether there might in the future be a small amount of funding available to support the endeavor. However, as Karen said, most of the initial groundwork was carried out by our PhD student, Stephanie Fair, a student with whom we've been working and who is looking for a topic for her PhD. At the beginning, we assembled a community reference group comprising a number of families throughout the world, and we consulted them on the topics and questions that should be included in the questionnaire. Then it was Stephanie's responsibility to build the web capture system to collect the data with the help and guidance of another research colleague who had bioinformatics expertise. Our system worked extremely well. So we launched the database in September 2012.
Let's talk for a minute about the richness of the data you've captured and the research effort that has led to over 20 publications on CDKL5, the most recent being the prestigious journal, The Lancet Neurology. So share with us a little bit about what you've learned.
Thank you, Karen. The data that we have collected from families has generated an extraordinary amount of new knowledge on CDD. And I will highlight at the very outset again what Helen has spoken about, that there are two important components for our foundation of knowledge, and that is the families who have been involved with sharing information with us, the parents who have been part of our consumer reference group, and IFCR. We've worked with them with you for 10 years now, and what we have established, we're able to continue very proudly working with you. So data has been collected from over 400 families who live in all corners of the world, and together that cumulates to become a very large impact, all guided by our consumer reference group. We have spearheaded the pipeline of discovery for CDD to discover its natural history. And in doing so, our database, the International CDKL5 Disorder Database, is recognised internationally. We have made very important inroads at a very fast rate because in today's world, we can work online with families. And what we have to wonder right now as we celebrate our 10th birthday is what new technologies will be available to support our 20th birthday in 10 years' time. From the data, as you said, Karen, we have been able to generate approximately 25 publications about epilepsy and other health issues, functional abilities, the experiences of diagnosis, and quality of life. This is important science that we have contributed. Right from the beginning, there was the seminal paper that established CDD as distinct from Rett syndrome, enabling clinical trials for CDD. We understand the milestones that are achieved by children. Approximately half will learn to sit and approximately a quarter will learn to walk. We have new understanding of functional abilities. We have much more knowledge about epilepsy, including the ketogenic diet and VNS therapies, as Helen described, and also other health issues such as breathing, gastrointestinal functioning, and sleep. With more numbers, we are becoming able to understand the role of the different genetic variants on the clinical presentation for the children. And this is all adding up to a very substantial understanding of CDD. Over that time, there have been exciting collaborations, for example, with Dr. Tim Benke in establishing a severity assessment that was part of the foundation for our new NIH-funded work on outcome measures for CDD, with Dr. Demarest on to join with his qualitative work on understanding experiences of diagnosis of CDD, and more recently with Dr. Amin in the UK in developing the first guidelines for care for individuals with CDD. So I'm really proud that CDD is also critical to our program of quality of life. Quality of life is the most important outcome for children and for their families and for us at the database also. And we have commenced that pipeline of work with CDD from interview studies where we understand authentic narratives about the meaning of quality of life for children with CD, understanding from our database what factors are associated with quality of life, and now including evaluation of quality of life in our NIH-funded study on outcome measures for clinical trials. And I think I'm circling back, Karen, to what you said at the beginning was the recent Lancet Neurology paper. And this was an invited review. It is an extremely prestigious journal. And this was led by Helen. And this has put CDD as a very strong presence into the very top journal in that is recognised, of course, internationally. So we're very proud of that. In all, we believe that the database has enabled recognition and knowledge of CDD across the scientific and the clinical communities. People can look up CDD and get reliable information. That information is disseminated to families who often ask questions, and to industry, to pharmaceutical companies who want to know what is the natural history of CDD and how should we measure impacts of the new treatments that they are developing.
So Ginny, can you speak a little bit to why we need to continue this effort and the importance of families continuing to enroll and participate in this research effort?
We absolutely need families to continue enrolling with the database. Our vision is that children and with CDD and their families have their very best health and quality of life. And we need to keep growing to achieve that vision because of the power of the community in building the strongest data set. A larger data set will enable us to keep going with these goals and, importantly, to remain contemporary to new needs and new treatments that are becoming available. We need to collect information on how children with CDD grow and develop and become adults. We need to keep on with developing and validating the best measures to measure outcomes in CDD clinical trials. And we need to keep collaborating with all of those other players in the CDD field who are also working to support the best outcomes for children with CDD and their families. For us, if we have a larger, more study, it is more powerful. And with longitudinal evaluations, we become even stronger. So it's extremely important. We look forward always to meeting parents and their child with CDD through our work and continuing that through IFCR. Thank you.
Thank you, Ginny.